Today we will discuss positive ANA test result in a simple and easy to understand way. Have you ever wondered what it means when your blood test shows positive for anti-nuclear antibodies? Anti-nuclear antibodies are a type of antibody that targets certain components within the nucleus of your cells. Finding them in your blood can point to several conditions, but it's not always a cause for alarm. They're commonly seen in systemic autoimmune diseases like lupus, systemic lupus erythematosus or SLE, and organ-specific diseases such as autoimmune thyroid disease. However, they can also appear in infectious diseases, some cancers, and even in healthy individuals. The key to understanding your ANA test lies in your symptoms and medical history. Common symptoms suggestive of a rheumatologic disease include inflamed joints, dry eyes, muscle weakness, and skin changes. Sometimes certain medications can also induce these antibodies, so it's important to review any drugs you're taking. What should alert you that your positive ANA test might be serious? A positive ANA test becomes particularly concerning if it's accompanied by symptoms like joint inflammation, muscle weakness, or unusual skin lesions. High levels of ANA, usually a dilution of 1 to 160 or more, are more significant. In such cases, further tests for specific autoantibodies are recommended as they can indicate diseases like lupus, Sjogren's disease, or mixed connective tissue disease. Additionally, if routine blood tests reveal abnormalities like anemia or renal dysfunction, it could suggest an underlying autoimmune condition. For women planning to become pregnant, specific antibodies against SSA-RO need to be measured due to the risk of neonatal lupus syndrome. What do doctors do next to understand the cause behind your positive ANA test? After a positive ANA test, the next step is to identify the specific type of autoantibody present. This involves tests like indirect immunofluorescence or solid phase assays, which can detect various autoantibodies associated with different autoimmune diseases. If specific autoantibodies are found, it might point towards conditions like lupus, Sjogren's disease, or other connective tissue diseases, but a negative result doesn't always rule out disease. Sometimes more specialized tests are needed to detect less common autoantibodies. In cases where the ANA test result is positive but specific autoantibodies are not found, the doctor might consider systemic autoimmune diseases or organ-specific autoimmune diseases. Further tests, like checking thyroid function or liver tests, may be recommended based on the suspected condition. Be sure to follow up with your healthcare provider for the next step.